Dr. Amesh Adalja is a senior scholar at Johns Hopkins Center for Health Security. He joins us live from Pittsburgh in the US state of Pennsylvania. Thanks very much indeed for being with us. So what did you make of the MIT study?
Not a whole lot. If you look at this study, you have to remember that this is a mathematical modeling study. In one of the assumptions in this modeling study is that instantaneously someone with COVID-19, that their breath, those droplets mix throughout the entire room. And that's not actually true. So if you look at the epidemiological data of how people get infected, we're not seeing people get infected 20 meters away. We're seeing people that are in close contact. That's where that transmission is. So I don't really put much stock into this. I think this isn't really something that fits with what we see on the ground when we look at case contact investigations of how people are getting infected. We would have a totally different epidemiology of infection if people were getting infected regularly at 20 meters apart. So I don't think that this is anything that should change our guidance or change the way we're doing things with this virus.
Tell me, there's also been in the UK a letter by a group of 22 scientists. They've written an open letter arguing that mandatory social distancing and face masks should be scrapped from June this year. At the time, that's when the UK is due to, take the final step out of lockdown, if you like. What do you make of that suggestion that those social distancing measures ought to go at the same time of the end of lockdown?
So it really all depends upon what's going on in the UK. So if hospital capacity is something that's no longer threatened because so many people have been vaccinated, if community spread is something that is of the past and not ongoing, I do think you can start to ease up on some of these social distancing measures. It really depends upon what the situation is in a given country. And I do think as more and more of the population is vaccinated, these social distancing measures are going to evaporate as people are able to go about their lives free from the fear of COVID-19. And we've removed the ability of the virus to cause serious disease, hospitalization, and death through vaccination.
What's interesting is that the CDC in the US has given updated guidance for people who've been vaccinated, whereas the UK hasn't. And it's sort of said, you know, things like requirement for masks might change if you've been vaccinated. Does it undermine the message that vaccines are effective if you don't then at the same time say, actually, you can now stop wearing masks indoors if you're fully vaccinated and so on?
I definitely think that there has been a lot of underselling of these vaccines. These vaccines not only prevent you from getting serious disease or being hospitalized or dying, they also prevent you from spreading this infection to a large degree. And we've seen that in countries like Israel. So it's very important for an individual to know that this vaccine changes their personal life, that they get their life back. They can do activities free from the worry of COVID-19 that they've had for over a year. So we really have to talk about how these vaccines benefit people personally, what a value they are to people in order to persuade them to get it. So things do change. And I do think the CDC guidance is cautious, but it does say that if you're fully vaccinated, you can mix with other fully vaccinated people without a mask. You can mix with certain unvaccinated people. You can travel without worry. All of that is really important to set the tone for what the world is going to look like after you've been vaccinated. And that does drive people to get the vaccine because it is a value to their personal life.
Just to return to the MIT study, I know you said you didn't think it added much, but did it highlight the issue of ventilation, which perhaps has been sort of one thing that was ignored in when people brought in new measures to combat COVID-19, that perhaps the issue of ventilation wasn't sufficiently understood originally?
At the very beginning of this pandemic, there was a lot of concern on surface transmission. We had people that were cleaning their mail, cleaning their groceries, and that really wasn't how people were getting infected. And I do think we lost the opportunity to talk about the transmission risks in indoor settings. And one of the ways to decrease your risk in an indoor setting is just to simply increase the ventilation. And that can be as simple as opening a window. That's going to decrease transmission. So I think that this is something that's important, and we want people to take the actions that actually have an impact on their risk for COVID. And increasing ventilation in indoor settings is something that is important. I do not think in most situations, though, people can get infected at 60 feet away or 20 meters away. But in general, if you can open a window when you're around people, especially unvaccinated people, that's going to decrease the risk of infection.
Dr. Amesh Adalja, thank you very much indeed for taking the time to talk to us. Appreciate it.
Thank you.